visa issue. But our first speaker will be Tai-Chi LIN, and he's going to talk on research in medical education, similarities and differences with clinical research.
Okay, thank you, Carl, and nice to see you again. And Anna, this is my 3 years in a row talking in this session, but I'm from Taipei Veteran General Hospital, and I'm colleague with Angar Wong. So
okay.
Right.
Okay.
Unfortunately, he's somewhere else.
I was just in a symposium with him.
Yeah, it's a symposium. Right. So okay, can we pull out the slides, please? Okay, thank you. So I'll be talking about research in medical education and what is the similarity and difference with clinical research. So I have no financial disclosures. So first of all, what is a research in medical education? It is the research that aim to understand the learning process. So these studies, they assess the curriculum design, instructional formats, or how actually learning is delivered to students, program and performance evaluation, even faculty selections and efficacy, and most importantly, learning environments and culture. So above all these studies are actually trying to improve the ecosystem of medical education. So just to give you a little hint, these are the most cited topics related to medical education. So it gives you an idea, roughly, what are the most popular interest research topics inside this field. So how about clinical research? Broadly defined, it covers the dynamic of health and disease. And we're always trying to determine the cost and confounding risk factors. And then most importantly, to the preventive measures and the treatment of human illness. So it seems very different what these two studies are research types are focusing on. However, they do share a lot of similarity. First of all, there are many journals that actually you could submit a medical education paper. If you look up from the PubMed, there are so many different journals. So the thing you have to, the similarity as a clinical research, the thing you have to do is you look up each individual journals and you find that the scope fits your research topic, and then maybe it has a higher chance to get accepted by these medical journals. And if you actually ask ChatGPT, you ask them to build up a figure saying that what is the related article published through the past 10 years, we can find that not only just for the clinical research, but also for the medical education research as well. The numbers of these articles being published throughout is increasing every year throughout the past decade. So they also share this similarity. Okay, and then what are the other similarities? First, number one, I think, how do you actually build up a medical research education research is similar to what you do when you initiate a clinical research. First, you have to refine your study design, your study questions. You ask yourself and you review the literature. Is there a knowledge gap that is worthwhile research? And then you clear the state problem. You clearly state this problem, and then you significantly try to address it. And finally, you develop a theory model or a theoretically contact that could fulfill this knowledge gap. So this is pretty similar to what we do every day in the clinical research. And the similarity number two, define your outcomes. Ideally, you would assume that these dependent variable of the study should answer the question that you are asking. However, sometimes it may not happen this way. You need to challenge the predicted outcome. Which meaning that what would the study suggest if the prediction was proven to be true or false? What is your story about related to this outcome? And then after, you have to have that before you even start to collect your data. So when you have your story, you collected information you needed and about the outcome in an unbiased manner. So this is also pretty similar to a clinical research. Similar to number three, I think the study designs and the method are also pretty similar. It could be an observation study related to medical education research, but instead of observe the behavior of a patient, it is actually try to determine the relationship associated between these variabilities. It could also be experimental, and also qualitative research, and validation research as well, and surveys, and also systemic reviews, which are also pretty similar to the methodologies of the clinical research. Summary number 4, remember to obtain your IRB. That is a very important issue. You don't want your paper to be rejected because you didn't obtain your IRB. And sometimes this could be very difficult because the regulations between each institute could be different. So if you're initiating a multi-center medical education research, make sure that everybody has their IRB approved. But so they share so many similarities. But why do education research feel so different from the clinical research we do every day? I think this is mainly due to the researchers who are doing the medical research, education research. They have been trained, educated in medicine, and some of them do clinical research, which some of them may only do clinical practice. But when they have the chance to become the investigator in a medical education research, they may not be necessarily prepared to initiate this kind of research project. So that's why it feels very different. And what are the other differences? I think between these two research, there are a fundamentally difference existing between. In the clinical research, it's more like a physical science. It is what we have been trained and taught in the pre-med or medical school. It is based, the majority is about finding the answers that you are asking. But how about the medical education research? It's more like a social science. It could be talking about the difference in education strategies, which may in fact reflect the outcome of the students. And then above all, I think most importantly, learning is a very complex process. Different curriculum delivered by different teacher could end up with various outcomes. So it is kind of difficult to evaluate. And finally, the time between the learning and important outcomes may be so long. You have to wait it for the student to graduate and for them to develop their career to actually see did the outcome work out. So it's very difficult to initiate a longitudinal study in medical education researches. And they are also different in components. In clinical research, as I mentioned before, it's more like a physical science. So it contains physics, chemistry, biochemistry, and even geology. But regarding medical education research, because it's more like a social science, it's not just about education. Sometimes it contains a little bit of psychology, anthropology, and also sociology. So that's why the components are very different. And the participant in these two studies are also different. In the clinical research, there is always a PI, so either a MD or a PhD, who is in charge of this research. There are research coordinators who actually do the day-to-day work of the research. There are sub-Is which help the PI. There are maybe CRA companies that they monitor the clinical trials. There are also pharmas and biotechnic companies who will support the fundings and resource for the clinical research. There are data managers and biostatisticians who will do the analysis. They may be a regulation specialist to monitor the ongoing clinical trial. And you will have scientists working on the bench who may also involve in the clinical research. Sometimes governments, such as FDA and NIH, they will be supervising the clinical research. And finally, patients and volunteers are also an important participant in clinical research. But how about medical education research? Most participants in medical education, they are the medical school administrations. They may be also student affairs deans or leaders in curriculum developments, or sometimes curriculum directors and research program directors. So the participants could be very different. And finally, last but not the least, although they may be different in study design, but they are all seeking a evidence-based research. But you can see we are very familiar with the methodology of clinical research, such as randomized, double-blind randomized clinical trials, observation case series. It could be prospective, retrospective, or database, or even bench science. But in medical education research, it is more like describing a new curriculum, providing a prospect or a new method of assessment, or how these medical students are doing, how the residents are doing, or modeling a different learning behavior, or you actually compare before and after a new delivered strategy is given to these students. And how do they different in outcome analysis? Although both studies types, they all aim to improve the outcomes, but in the clinical research, it is really major in the patient-centered outcomes, where the medical education research is more a learning-based outcome evaluation. And then in the clinical research, it's more objectively and quantified measurements, where the medical education research, they are more subjectively and maybe qualitatively measurements. And finally, in clinical research, mostly are focused on statistic significance. But in medical education research, the majority may just be a description statistic. So this is the major difference between the outcome analysis. So in conclusion, research in medical education shares similarities with clinical research. They are pretty similar in systemic methodologies, data collections, analysis to improve their outcomes. However, medical education research focuses more on the learning process itself, curriculum developments and teaching effectiveness, rather than a patient-centered clinical outcomes. But both fields, they emphasize the evidence-based approach. Clinical research usually relies on the high evidence randomized clinical trial and biological measurements, where medical education research frequently just incorporate with the educational theories. So understanding the difference and the similarity is essential when you try to approach the research methodologies in each domain. So I think at the end of the day, no matter what kind of research you are trying to initiate, I think the most important part is collaborate. You cannot do each kind of research on your own. Collaborate with the specialties and use their expertise will guarantee you a wonderful research path.
Amongst those, in recent times?
In recent times, I think it's more like the skill, like the skills, the education skills, like how we improve the education skills to improve our education outcomes. And I think another one is more like the evidence-based learning. We changed like the traditional curriculum to like a more interactive, evidence-based student learning method. So I think these are the popular topic in recent days.
And anything unique in medical education as opposed to overall changes in the way education is now being imparted?
I think there are more back and forth. But I think at the end of the day, the evidence base is more emphasized, and so everything goes from what the teacher delivers to the student. Turns out there's a trend changing to the evidence-based learning. Yeah.
Thank you, Dr. Lin. This is not a question, but a comment. It's a very important topic, the one that you have discussed, because most of us teach, but not many of us are evidence-based. And the other thing is that doing research in medical education is a way of increasing our CV on research as well. Yep. So thank you for